Good afternoon, everyone, and welcome to today's COVID-19 update. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci. Before I start today, I just wanted to focus on a couple of points before I get into my official notes. Nova Scotia has announced 96 cases today, and really and truly what we're seeing in Nova Scotia right now and what we've been seeing all across Canada and other jurisdictions around the world, basically there is a fire all around us and we are feeling that heat, and I know a lot of people are exhausted and discouraged, but we really have to keep fighting these flames. And this pandemic is a living history. Every day we are provided an opportunity to write a new chapter. So we need to work together to fill New Brunswick chapters with examples of grace, kindness, understanding, and generosity to others. Anyway, I just wanted to make that point before I start. Good afternoon, everyone. Bon après-midi à tous et à toutes. It is my sad duty to report that another New Brunswicker has died as a result of COVID-19. The tragedy of this latest death of a person who resided in the Moncton zone is compounded by the fact that the deceased is in their 20s. This is the youngest person among the 36 deaths from COVID-19 that have been reported in our province since the pandemic began. Il s'agit de la plus jeune personne parmi les 36 qui sont décédées des suites de la COVID-19 dans la province depuis le début de la pandémie. Ce décès nous montre avec gravité que ces variants frappent sans discrimination. It can and will strike the young as well as the old. We are reminded again of the urgency of protecting ourselves, our families, our communities, from the effects of the new COVID-19 variants of concern and interest. New Brunswick now has the South African variant in Zone 2 and in Grand Falls. We have the UK variant in Zones 1 and Zone 4, and the India variant is in Zone 3. The thing about the variants in what we talk about the India variant is that the presence of the India variant has been confirmed in the Zone 3 by the Georges Dumont Hospital Center for Microbiology in the lab in Moncton. We have to emphasize the importance of protecting the privacy of New Brunswickers who are impacted by COVID-19, and small details can compromise a person's or family's health privacy. So in our quest to discover more about an illness, we do have to remember there are people behind these numbers. And at this point, it should also be assumed that all cases originate from one of the new variant strains, as they are dominating the viral landscape. And contact tracing for multiple cases and possible public exposures is ongoing, and if public health reaches out to you to say that you have been identified as a close contact of someone who has tested positive, please follow the directions. Je tiens à exprimer mes sincères remerciements et ma profonde gratitude aux citoyens d'Edmundston de la région du Haut-Madawaska. Depuis un mois, vous avez dû vivre des situations extrêmement difficiles dans le but de ralentir la propagation du virus responsable de la COVID-19. Et je suis heureuse d'annoncer que vos efforts ont porté fruit. Il n'y a aucun nouveau cas à signaler aujourd'hui dans le secteur d'Edmundston qui est en confinement depuis le 10 avril. Et je suis rassurée par la diminution de nombre de cas hospitalisés et dans les soins intensifs. While there are a number of new cases in Zone 4 today, they are all connected to the outbreak at the Pavillon Beaulieu Special Care Home in Grand Falls. We have seen no new incidents of community transmission within the lockdown area, and hospital admissions in the area have declined significantly. Very, very good news. The 7-day rolling average of new cases in the lockdown area has fallen from more than 10 earlier this month to just 2 as of yesterday. Also very good news. Par conséquent, Santé publique a recommandé au cabinet que le secteur d'Edmundston quitte la phase de confinement et progresse à la phase d'alerte orange de notre plan de rétablissement à compter de minuit ce soir. The Grand Falls-Drummond area will remain at the orange alert level for at least another week. The situation will be reevaluated at that time. While the pandemic has been hard on all New Brunswickers, the people of Edmundston have endured more than their share of restrictions. Zone 4 was in lockdown in late January and early February during the second wave of the pandemic. These restrictions were again required this month as the third wave hit and the new variants of COVID-19 virus emerged, specifically the UK variant. Les deux fois, les citoyens de la région de Madawaska ont fait ce qu'il fallait faire. Ils ont travaillé ensemble de façon à réduire les risques de transmission et ont graduellement ralenti la propagation du virus. Pour tout ce qu'ils ont fait, ils méritent la reconnaissance du reste de la population du Nouveau-Brunswick. But even as one threat recedes, new ones emerge. Public health is closely monitoring the situation in Zone 3, which is Fredericton and the St. John River Valley. This area has New Brunswick's first confirmed case of the COVID-19 variant first identified in India. In the coming days, we will determine if new public health restrictions are required to slow the spread of the virus in Zone 3. And we will not hesitate to act to protect the health of New Brunswickers. The India strain is currently seen as a variant of interest. Like the UK, South Africa, and Brazil versions that have preceded it, this variation is a natural stage in the development of a novel virus like COVID-19. And as the virus spreads, it will change and adapt. This new variant introduces yet another layer of complexity to our efforts to control COVID-19. And the issue is not what we know about this particular variant, but rather what we don't. This is why we've been treating all new cases as variants in New Brunswick for the last several weeks. And this is why we are urging everyone to continue to follow public health guidance and advice. An outbreak has been declared at the University of New Brunswick in Fredericton following a confirmed case of one of the university residences. UNB has taken the prudent step of closing the campus to all non-essential activities, and potential contacts are self-isolating on campus. All residents of McGee House, which is adjacent to the UNB campus, were tested yesterday and will be retested later this week. Public health will also be testing residents of Elizabeth Parr House following a possible exposure there. With this outbreak in Fredericton, we have advised the public of several potential exposure incidents. The full list is on the government website. If you have been in these locations on the days and times reported, please seek testing immediately. You don't have to wait for symptoms to emerge. Public health will also be providing a temporary testing clinic in Nakawik following a potential public exposure there. A testing site will be set up in the parking lot of the Nakawik shopping mall from 12 noon to 5 p.m. on Wednesday, Thursday, and Friday of this week. People with symptoms are asked to request a test online or call Telecare 811 to get an appointment at the nearest screening center. When requesting a test online, please select Heartland as your preferred site. When you are called for an appointment, indicate that you wish to be tested at the temporary site in Nakawik. The sooner we can identify potential infections and get them into self-isolation, the sooner we will be able to control this latest outbreak and get it under control. Aujourd'hui, Santé publique annonce qu'il y a 24 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 21 nouveaux cas dans la zone 4. Comme je l'ai mentionné plus tôt, tous ces cas sont des contacts étroits de cas existants liés à l'éclosion qui sévit au pavillon Beaulieu, un foyer de soins spéciaux à Grand-Sault. Il y a 2 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. L'un de ces cas est un travailleur étranger alors que l'autre fait l'objet d'une enquête. Il y a aussi un nouveau cas dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean. Ce cas fait toujours l'objet d'une enquête. Il y a présentement 137 cas actifs de COVID-19 dans la province. De ce nombre, 6 personnes sont présentement hospitalisées en raison de la COVID-19, dont 2 aux soins intensifs. Today, Public Health is reporting 24 new confirmed cases of COVID-19 in New Brunswick. In Zone 4, there are 21 new cases, and as I mentioned earlier, all of these are contacts of existing cases linked to the ongoing outbreak at the Pavillon Beaulieu Special Care Home in Grand Falls. There are 2 new cases in Zone 1, which is Moncton and southeastern New Brunswick. One of these is in a temporary foreign worker, and the other is under investigation. There is also 1 new case in Zone 3, which is Fredericton and the St. John River Valley, and this case is under investigation. This virus has impacted the lives of so many of our fellow New Brunswickers. Whether they are gravely ill, isolating at home, or in self-isolation awaiting a test result, they all need our support. Please keep them in your thoughts and prayers. The outbreak in Fredericton has also had an impact on schools in the city. Yesterday, a confirmed case of COVID-19 was confirmed at George Street Middle School. The school community has been notified. And I know there is a lot of anxiety among families that are isolating. I'm a parent. My children actually interact with kids who go to George Street Middle School or their siblings. So I do understand, and I have friends and colleagues who have to self-isolate right now as a result. So I do understand this is a very, very stressful time. So please do support one another, and please get the support that you need. Again, all new cases are presumed variant, which are more contagious and can cause more severe symptoms. We have been able to avoid what other jurisdictions are facing, so please continue to follow all public health measures. Public Health has advised all staff, students, and their families of the school to self-isolate until midnight on Thursday, April 29th. This will enable Public Health to conduct testing and contact tracing. And I was asked this morning on CBC why people were not being rapid tested. We actually are rapid testing, and by rapid testing I mean the Gene Expert, which is a PCR-based diagnostic test for the close contacts of the case. The school will be closed for 3 days, and to date more than 900 tests have been conducted. Testing will be mandatory for all students and school personnel. Anyone who is determined to have been in close contact with the confirmed cases will be directly notified by Public Health. And remember, no news is good news. And if you do not hear from Public Health, you have not been identified as a close contact. Cette pandémie nous met au défi chaque jour. L'évolution du virus nous oblige à demeurer sur nos gardes et à rester vigilants, même si nous sommes rendus au point où la fatigue se fait sentir. Nous sommes tous tannés. Nous voulons tous revenir à une vie normale, mais nous gardons espoir et l'espoir nous permet de continuer à persévérer. Et on arrive d'ici à 10 semaines d'avoir de nombreux gens vaccinés avec une dose du vaccin, ça s'en vient. Le nombre de citoyens du Nouveau-Brunswick qui ont reçu leur première dose de vaccin contre le COVID-19 continue à augmenter. Et ça, c'est des nouvelles positives aussi. More than 1/3 of us have now received at least one dose. This is extremely encouraging. By getting more people vaccinating, we are reducing the risk of serious illness, hospitalization, and death from COVID-19, which is what we've been trying to achieve this entire duration of the pandemic, to prevent our healthcare system from being overwhelmed. We are protecting and preserving our healthcare system by doing all of the things that we are doing right now. So I do implore each and every one of you to embrace hope wherever you find it. Hope has the power to transform us, to help us fight the light, to find the light that lies ahead on the journey through this pandemic. And where there is hope, there is light, and we still have hope. Thank you very much.
Good afternoon. Good afternoon. Bonjour. Today I'm deeply saddened to learn of an individual aged 20 to 29 that has passed away in Zone 1, the Moncton region, and as a result of COVID-19. This is the youngest person in our province whose life has been lost to this virus. In addition to the person who sadly passed away in the weekend, 36 New Brunswickers have now lost their lives to COVID-19. C'est un rappel tragique que le virus constitue toujours une menace sérieuse. Il peut nous atteindre à n'importe quel moment. On behalf of all New Brunswickers, Marsh and I would like to share our heartfelt sympathies with the loved ones of the people who have passed away. Our thoughts and prayers are with everyone who has been affected by these terrible losses. Today, we are continuing to ramp up our vaccination efforts. People 60 and older can now book an appointment to receive their first dose of the vaccine. Anyone in this age group or a caretaker or family member calling on their behalf can contact a pharmacy directly to schedule their appointment. They may also make an appointment at the Horizon Health Network or Vitality Health Network Clinic by visiting gnb.ca/book-a-vaccine. We are continuing to make excellent progress with our vaccine plan. 34% of New Brunswickers have now received their first dose of the vaccine. As of today, New Brunswick has the highest percentage of residents who have received their first dose in the Maritimes. I am also pleased to confirm that Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health to move the Edmonton and Upper Madawaska region from lockdown to the orange level effective tonight at midnight. Border management has been an area of focus and concern, and we're trying to balance that, all the while providing some freedoms as the opportunity presents itself. La région de Edmonton a été durement frappée par le virus au cours des derniers mois, et je veux remercier tous les résidents de cette région d'avoir contribué à maîtriser cette dernière éclosion rapidement. Le virus est encore présent et ce changement de niveau d'alerte ne veut pas dire que nous pouvons baisser notre garde. Mais ce changement permettra d'avoir certaines libertés de plus et permettra à de nombreuses entreprises de la région de reprendre leur activité. Les gens peuvent maintenant aussi passer du temps avec le groupe de contact les mêmes 10. I am hopeful that Zone 4 will continue to move in the right direction in the days and the weeks ahead, and that we'll be able to further loosen restrictions there very soon. We must continue, however, to follow all the public health rules. We will continue to be vigilant at the border between our province and Quebec and Maine, and we must ensure that we protect the region. But in doing so, everyone continues to do their part. We will continue to operate differently in New Brunswick and be able to move through this pandemic. We are continuing to keep a close eye on Zone 3, the Fredericton region, where a case of the variant first discovered in India was confirmed yesterday. And we will continue to listen to the advice of public health if any actions are required in the days ahead. On Friday, we announced new travel guidelines aimed to keep COVID-19 out of New Brunswick as much as possible. Due to the emergence of new variants, it is imperative these new rules be followed closely to ensure we do not lose control of the situation. I know we're asking a lot of New Brunswickers right now, especially those individuals who regularly cross the borders for various essential reasons and do so on our behalf. Under the new rules, truck drivers and cross-border commuters must follow modified isolation guidelines. The only real change is that we are asking them to stay in their home whenever they are not working. Their families are not required to isolate, but they must follow public health guidelines and minimize contact with others as much as possible. Rotational workers must self-isolate for 14 days, separate from others upon returning to New Brunswick. If they choose to isolate at home with other people, everyone in the household must also isolate for 14 days. Je suis d'accord avec les gens qui pensent que ces mesures sont sévères. Mais quand je vois ce qui se passe autour de nous, il est évident que ces mesures sont nécessaires. Now more than ever, it is important that we protect our borders. There are cases all around us in the surrounding jurisdictions of Nova Scotia, Quebec, and Maine. We have seen what is happening farther west of us. There is an increasingly high number of people in the hospital and the ICUs. The armed forces have been called in to assist in Ontario. We are doing our best to avoid a situation like that here in New Brunswick. We cannot lose hope, and we must continue to be diligent because we are so close to the finish line, at least the modified finish line when we all have our first dose of vaccines and the others to follow soon thereafter. We have been fortunate to be shielded from the level of devastation we are seeing elsewhere. And it's easy to forget what could happen if we did nothing. But we cannot avoid what is in front of us, and we must react appropriately. We have also had tragedies of our own, and there have been personal experiences that I am sure have been devastating. We have seen situations where a traveler returned to New Brunswick with COVID-19 and, without realizing it, brought the virus into their home. We have seen the virus spread quickly to other members of the household, in some cases making them very sick and in other cases, leading to death. Let me speak for a moment about our truck drivers and essential workers. We have, from the very beginning, saluted and appreciated the work that you do every day. You work long hours that have made only things more difficult in the case of dealing with the virus. But you've kept our economy moving, and we're so appreciative and thankful for everything that you do and have done every day. We know the new frustrations or the new restrictions are frustrating. We know that it can be a little more difficult, but we sincerely need your help. We must continue our diligence. Between March 21st and April 26th, 30 New Brunswick truck drivers and rotational workers received positive COVID-19 test results. I'm not saying this to put any blame on anyone, because we know what you do every day, and crossing the border is an essential service that we've all valued. Every travel category has also had cases, but we know that there's a serious risk. But we know those risks can be significantly mitigated when we follow the protocols of public health. No matter where we are, no matter what province you're in, if you follow the rules closely and carefully, you can come home safely, and you've demonstrated that over and over again over the past year and several months. Nous sommes tous vulnérables face au virus. Bien que la chance soit moins élevée d'être malade, une fois que nous avons été vaccinés, il est encore possible de contracter la COVID-19 et de la transmettre aux autres. Nous avons vu comment les variants peuvent se propager rapidement dans une communauté et toucher même des personnes qui sont jeunes et en santé. Ce qui se passe dans les autres provinces pourra facilement arriver ici, si nous ne sommes pas vigilants. Our success up until now has not been accidental. We have taken deliberate steps to slow the spread of the virus from the very beginning of the pandemic. I know that the measures we've taken have not been easy. They have taken a toll on us all, and we've been forced to make sacrifices. But these sacrifices have protected us from experiencing much greater losses. Our previous guidelines were not enough to protect us from the variants that we know are now present in our province. We needed to take stronger actions to protect New Brunswickers as much as possible. En même temps, nous essayons d'inviter de mettre en place certains règlements encore plus sévères comme dans d'autres provinces. Par exemple, le couvre-feu de la 20 heures au Québec. Mais ces mesures réduiront les risques. As we also announced on Friday, leisure and non-essential travelers, as well as people moving to New Brunswick and business travelers, must self-isolate for at least 7 days in a designated isolation hotel at their own expense, which will be around $200 per day. I know this is not easy, but in fact, if you have an option, we don't want you to travel back to New Brunswick right now. We want you to make other arrangements and stay where you are. Let us get through this wave. We want you back, and we want you back safely, and we want to do so at a time that is best for all concerned. Upon arrival, if you're coming back, we must ensure that you have a COVID-19 test on day 5 of your isolation, as well as you'll be tested when you leave and arrive. If they receive a negative test, which is usually available on day 7, then the travelers must complete their 14-day isolation at home, as long as no one else is in the household. They must also take a second COVID-19 test on day 7 of their isolation. Over the weekend, we identified designated hotels in St. John, Moncton, Fredericton, Campbellton, and Bathurst. A hotel has not been identified in Edmundston because that region was in lockdown, but one will be announced there very soon now that the lockdown is ending. Before travelers return to New Brunswick, it is essential that they register their travel first on the GNB website. Once they have received their travel registration approval number, returning travelers must contact the Canadian Red Cross at 1-800-863-6582 and select the option NB isolation support to non-essential travelers. Our representative will assist and provide a booking code. The traveler will then need to call the hotel they have been assigned to and make a reservation. The hotel will ask for the traveler registration approval number and booking code. Upon arrival in New Brunswick, travelers will be asked to show their travel registration approval and confirmation of the hotel booking to a border control officer. Travelers can then proceed to their accommodations. They cannot make any stops along the way and must drive themselves or take a taxi. Family pickups or carpooling are not permitted. Ce n'est pas le moment de faire des voyages qui ne sont pas nécessaires. Je comprends que ces étapes peuvent sembler difficiles, mais honnêtement, ces mesures visent à décourager les voyages qui ne sont pas essentiels. As of this morning, the Red Cross reported 59 rooms at isolation hotels are currently occupied. I have heard some people say they would rather face fines than isolate in a hotel. So I want to make sure everyone understands what those fines involve. I firstly am concerned that people would take that position, but I know many of you feel that you can go home and isolate properly. Unfortunately, we've had numerous cases where that has not been the case, and right now, we just cannot take the chance. Maybe that'll change in a week or 2 or 3. But because we evaluate and look at our situations each week and what can we do differently? What can we do better? What have we learned? But right now, a lot of people have worked very hard to keep us safe. So let's not take any additional risks. But in relation to fines, as I announced on Friday, we have increased the minimum fine for violating the mandatory order from $292.50 to $580.50. That fine applies to each offense under the Emergency Measures Act. And if the offense continues past 1 day, the fine per the offense is $580.50 per day. That means that if a leisure traveler is caught not isolating as a designated hotel for at least the 7 days required, they can be fined a minimum of $4,063.50. Maximum fines have also increased to $24,482.50 per an offense. Traveling right now is not worth the health or financial risk. Faites le bon choix pour vous et pour les gens autour de vous. Et, si possible, restez près de chez vous. Ces restrictions ne seront pas en place pour toujours. Nous avons besoin de temps pour réduire la propagation du virus, pour éviter d'aborder notre système de santé, pour garder la grande partie de la province dans la phase de lutte urgente et pour prévenir des confinements généralisés. I am hopeful these tougher regulations will only be in place for a relatively short time. We will continue to reassess the situation as it evolves, and we will continue to listen to the advice of public health. I am aware that these restrictions are beyond inconvenient. The announcements we made last week have thrown many lives into a state of turmoil. But I am convinced that if we are able to celebrate summer in New Brunswick, maybe not completely like we did in past summers, but so much better than we did last year and what we could do if we don't control the situation. I am convinced these several weeks of significant inconvenience will be forgotten, and we'll be glad that we arrived safely. Since the pandemic began, we've had to adapt and then adapt again, as COVID-19 has constantly thrown a wrench into our plans. Right now, the situation is challenging, to say the least. C'est très pénible pour de nombreuses personnes, mais c'est grand même mieux que les autres possibilités. Nous allons continuer de faire tout notre possible pour protéger les gens de Nouveau-Brunswick, même lorsque nous devrons prendre des décisions qui ne sont pas populaires. On ne le dirait pas à ces moments ici, mais il y a de l'espoir à l'horizon. Every day, more and more people are getting vaccinated. Every day, we are closer to the end of this pandemic. I want to sincerely thank New Brunswickers for continuing to step up. Just yesterday, a memo went to members of the public service looking for people willing to staff our vaccination phone line and to provide cleaning services at the regional hospital in Edmonton. I was pleased to hear that within 2 hours, 40 civil servants had offered to help with these critical needs. Once again, our public service is rising to the occasion and embodying the spirit of one team, one GNB. We constantly are hearing stories like this. A recent call went out for qualified volunteers to help administer vaccines. A retired nurse recruited several of her friends who are also retired nurses, and they have been administering vaccines for the last few weeks. I want to genuinely thank you. I want to thank every volunteer. I want to thank everyone who's taken the extra effort to keep us safe. We are resilient, and we care deeply about helping each other and helping the people around us. If we all continue to stay vigilant, if we continue to do our part by following public health guidelines and by respecting the mandatory orders, we can slow the spread. We can control the spread. We can contact trace when we do have an outbreak, and we will continue to be able to get them under control. Let's all work together to protect one another and stay as safe as possible. Let's ensure we make it to the finish line and we maintain the diligence and the vigilance that we have done so thus far. Thank you. Merci.
Thank you, Premier. Dr. Russell, merci beaucoup à vous deux. We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Bernard Labelle, Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre Higgs. Vous avez parlé la semaine dernière qu'il y avait beaucoup de travailleurs dans les foyers de soins encore qui hésitaient à se faire vacciner. J'aimerais savoir si vous envisagez de rendre cela obligatoire pour ces travailleurs de se faire vacciner ou bien de forcer un peu comme au Québec aussi de se faire dépister un certain nombre de fois par semaine.
Well, yes, we certainly are testing or checking, and I am pleased to say that we've had very good response from these nursing home workers, special care workers, and willing to get vaccinated. And I will get an update on that this week again. And we are, as I said before, we're contacting the nursing homes, special care homes directly, and that goes into contacting the individuals directly. But thus far, the response has been positive, and I don't have the exact number of the increase at this stage, but I am feeling that we are certainly getting the necessary response and reaction to get more vaccinated of those workers in those facilities.
Thank you beaucoup. Silas Brown, Global TV.
Thanks, Bruce. I'm curious about the situation at UNB, speaking to some people living in the affected residences. Ventilation has been a major concern that has come up. I'm curious if there's been any assessment of the ventilation situation in these affected residences and if it is adequate to ensure that people are being protected while they are unable to leave their apartments or units.
Hi, Silas. So I've had some email conversations with one of our public health inspectors who I was on call with on the weekend, and he was in touch with the company that does the ventilation and understands the engineering components. On Sunday, we did have a preliminary look at that, and then today I received more information about whether or not their assessment meant that there could be any improvements or changes. So I think there are some minor changes that they can do to make sure that there is no problems in terms of contamination of the airflow, et cetera. So they're working on that as we speak.
Thank you, Mr. Brown. Thank you, Dr. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Dr. Russell. J'aimerais savoir ce que vous pouvez nous dire sur l'état de santé de la personne qui est décédée. Est-ce qu'elle avait par exemple des problèmes de santé qui la mettaient à risque du virus?
J'ai pas entendu la question. Est-ce que vous pouvez le répéter?
Oui, désolé. Excusez-moi. Je me demandais si vous pouviez nous dire sur l'état de santé de la personne qui est décédée. Est-ce que cette personne-là avait par exemple des problèmes de santé qui la mettaient à risque du virus?
Je peux pas entendre. Est-ce qu'on peut ajuster le volume? C'est trop faible.
Alexandre,
Vous m'entendez? Oui.
peux-tu parler plus fort, s'il vous plaît, à vos micros?
D'accord. Est-ce que c'est mieux?
Oui.
D'accord. Désolé pour ça. Je voulais savoir ce que vous pouvez me dire sur l'état de santé de la personne qui est décédée. Est-ce que cette personne-là avait des problèmes de santé qui la mettaient à risque du virus?
Comme vous le savez, à ce moment-ci, les gens qui ont le COVID-19 au Nouveau-Brunswick, c'est plutôt tous des variants. Alors, on sait que les variants peuvent causer plus de problèmes au niveau de la santé, les symptômes plus sévères que le virus avant les variants sont arrivés. Alors, je peux seulement dire que c'était quelqu'un qui était qui avait le COVID-19 qui avait un des variants. Je crois que c'était celui du Royaume-Uni.
Merci beaucoup. Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. What is the procedure for when someone isolating in a hotel tests positive for COVID-19? Will they be moved from the hotel, and how long will they have to keep isolating, and where?
At this point in time, I would have to defer to my JPS colleagues around that part of the operational plan. My understanding is they would stay in the hotel and continue their self-isolation there.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, based on what's happening around the world, how effective does the vaccine appear to be against the India variant B1617? And is it possible that by July 1st, when we've all had the chance to get the vaccine, that we might be living with an even stronger variant that's resistant to the vaccine?
Hi, Vicky. So we're sort of an experiment in progress globally right now with respect to vaccines and what's happening as the new variants emerge. Certainly, we look to our jurisdictions in the world that have had the majority of their population vaccinated, so places like the UK and places like Israel, when we look at their data and have conversations with them, they are looking at what's happening with their vaccinated population. How many breakthrough cases do we see? How many of those breakthrough cases require hospital admission and ICU admission, and how many deaths are there with those breakthrough cases? So it is continuing to evolve. At this point in time, we can't really say what percentage of people who are vaccinated with 2 doses of the vaccines available would have a breakthrough case, but as the variants of concern continue to evolve and emerge, we can just say, based on what we know right now, our best information today is that 2 doses of the vaccine will protect us from hospitalization, severe symptoms, and ICU admission and death to a very, very great extent. So just coming back to the outbreak in Zone 4 in Grand Falls, people were asking around, how many of the people have been vaccinated in that outbreak. And I don't have an exact number, but my understanding is that there's quite a large number of people who have been vaccinated. And again, we're seeing very mild symptoms. And I think some of the people have only been vaccinated with 1 dose. So that is very good news, because that particular outbreak is the South African variant. So again, we are going to continue to monitor and get data. And as we do, we'll continue to learn. But as of right now, we do know that 2 doses offers the most protection against all the different strains at this point in time. But how protective they will be against each and every specific different variant of concern will be evolving and learning from.
Thank you. Maude Montembeau, Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Russell. Dr. Russell, j'aimerais que vous nous disiez comment le fait que la population du Nouveau-Brunswick est parmi les plus âgés du pays influence la campagne de vaccination ici en comparaison avec les autres provinces.
Bonjour. Le fait que notre population est plus âgée était quelque chose qui était impliqué dans notre le programme d'immunisation au niveau de les âges qu'il fallait faire certaines qu'on protégeait au fur et à mesure qu'on recevait des doses du vaccin. Alors, au niveau des pourcentages de la population, parce que ma fille me demande chaque semaine comment est-ce qu'on fait avec les pourcentages de la population qui est vaccinée comparé à les autres provinces, parce que j'ai entendu en telle province, c'était tel pourcentage, puis tel âge. Comme pourcentage, je crois que ça va très bien, mais est-ce qu'il y a des délais dans des vaccinations des moins âgés à cause de la population qui est tellement âgée ici? Un peu, oui, mais fur et à mesure qu'on recevra les doses plus nombreux à la fin de mai puis le commencement du mois de juin, on va attraper et toutes les gens qui peuvent recevoir un vaccin d'ici à le mois de juin, toute la population qui peut et veut, ils vont recevoir un dose par la fin du mois de juin. Et par le commencement du mois de septembre, on espère que tout le monde aura 2 doses. On vient juste de savoir qu'on va recevoir 12 500 doses de Moderna cette semaine. Alors ça va nous aider à accélérer notre programme. Mais il y a toujours des choses qu'on ne peut pas contrôler dans le déroulement de notre programme. Mais à ce moment-ci, je crois que c'est très efficace la manière que ça déroule à ce moment-ci. Et aussi, on va recevoir des doses de Pfizer cette semaine.
Merci beaucoup. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour Dr. Russell. Alors, Dr. Russell, j'aimerais avoir plus de détails sur la situation au foyer Beaulieu de Grunso. Il y a 21 nouveaux cas. J'aimerais savoir combien de personnes résidentes et combien d'employés et de gens de l'extérieur ça comprend.
Je crois que j'ai des noms en total. Aujourd'hui, je sais que les cas, c'est 14 résidents et 7 staff. Mais en total, pour toutes l'éclosion, je ne sais pas si j'ai tous les noms. Mais je vais essayer de les chercher. OK, Michel?
Laura Lyle, CTV.
Thank you, Bruce. This question is for Dr. Russell. I think this question might have been asked already in French, but I'm hoping to get it answered again. The person who passed away in the province most recently, the person in their 20s, did they have any underlying medical conditions? And is there anything you can tell us about where or how they may have contracted the virus?
Well, at this moment in time, for confidentiality reasons, I don't really want to release any more information than what I already have, in that I believe it was the UK variant that this person had, and it was travel related.
Thank you, Ms. Lyle. Adam Harris, Brunswick News.
Thank you, Bruce. Question for, I guess, both the Premier and Dr. Russell. Nova Scotia has called in the Army to help administer rapid tests amid the outbreak in Halifax. I wanted to know if New Brunswick's considering ramping up its rapid test usage. As federal numbers show, the province has hundreds of thousands that have been unused.
So that's a great question, because we do hear lots of reports about different kinds of testing in different provinces, and certainly right now, because of the outbreak in Nova Scotia, we do hear about rapid tests. But my conversations with the Chief Medical Officer of Health, Dr. Strang, yesterday, we were actually discussing the specific type of testing that they're using, and they are actually using PCR tests. So they're not actually using what we think of as a rapid screening test, which obviously are not as reliable. My understanding is they're using PCR tests, and so they're in a situation where they're able to do that at this point in time, and it's quite necessary. For New Brunswick, again, we use the Gene Expert rapid test, which is a PCR diagnostic test, when we need to in outbreaks. usually in institutional settings. And so we have been doing that with the UNB outbreak, and usually we do that at the beginning of an outbreak in a nursing home or adult residential facility or a long-term care facility. So we do use them quite in a targeted approach. For right now, our capacity is great, so there's no issue anywhere in the province right now in terms of testing. And here in Zone 3, obviously, we've had to ramp up to do the testing for UNB, the residences, and we're going to do serial testing there. And we are doing the testing at George Street Middle School as well. And then we're also now doing that testing for people that are doing the self-isolation in hotels.
Nicolas Steinbach, Radio-Canada.
Merci Bruce. La question est pour le docteur Russell. Et si M. Higgs veut commenter après, libre à lui, bien entendu. C'est concernant la maladie inconnue. On recense maintenant 47 cas au Nouveau-Brunswick, 37 confirmés, 10 cas sont soupçonnés. On voudrait savoir c'est quoi la prochaine étape. Quand est-ce que le site web qu'on nous a promis serait disponible? Et c'est quoi la prochaine étape pour le gouvernement et la santé publique?
Ta question, Nicolas, s'il vous plaît.
Oui, c'est concernant donc la maladie inconnue.
Oh,
Où il y a...
OK. Alors,
Oui,
votre
la
question,
prochaine étape.
la prochaine étape.
Quand est-ce que le site web sera disponible?
Oui, le site web s'en vient sous peu et on a de travail collaboratif qui se déroule avec le niveau, au niveau national et aussi provincial. Alors, on a toute une équipe de gens et je crois qu'il s'était déjà annoncé qu'il y a de l'argent qui a été mis dans le budget pour aider avec toutes les recherches qui ont besoin d'être faites sur ce sujet. Est-ce que c'est clair?
Il n'y a pas de date précise donc pour le site web, on ne sait pas encore exactement.
Ce soir, Nicolas.
Merci beaucoup.
Merci.
Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, can you confirm the outbreak at UNB is related to travel outside the country, and did it start because someone failed to self-isolate properly?
Well, I would not be specific about what kind of travel other than it's travel related. Whether you travel outside of the province in another area of this country or another country, the variants are everywhere. So, and we're very concerned about the fact that this outbreak in Zone 3 is a variant, and it's the India variant that we're very, very concerned about in terms of being very, very, very aggressive in terms of being contagious and causing more severe symptoms. So we will be acting and taking all the precautions and all the steps similar to what we had done in Zone 4 around trying to contain this as quickly as possible. And in terms of self-isolation, my understanding, every single time we have a travel-related case, if there are issues around self-isolation and we do see some transmission, I wouldn't necessarily say that in this particular case. But, you know, I think people try to do their best and they try to take all the precautions necessary. But I don't really have any more details around this particular situation.
Thank you, Ms. McKinnon. Michel Corriveau, Dr. Russell a un suivi pour toi.
Oui, vous avez demandé combien de résidents puis combien d'employés dans cette éclosion, et c'est 24 résidents et 9 employés.
Teresa Blackburn, River Valley Sun.
Thank you. I'm just wondering, and it may have been asked previous in French or possibly yesterday. I wasn't able to listen in yesterday, but I'm wondering for Premier Higgs, what was the criteria in choosing COVID isolation hotels? And what are you doing to try and find one in the Woodstock area after it was announced yesterday that we didn't have a hotel here?
So there will be the public safety are reaching out to find. We're working with the Red Cross in terms of how we manage this, and we're reaching out to the hotels in Woodstock to set one up. So that should be done, I would say, within the next day or so that it'll be clear. The criteria around moving to this was basically what we have seen in the past without the variant is that, you know, there was some ability to protect against the original COVID-19 and following the public health rules. But if people deviated from them even a little bit, you know, there was a little more forgiveness. But in the variant situation, there isn't. And we've had people that were supposed to go home and isolate, and we kind of, they would come in and go to their home. And so, but they really didn't. They would maybe go to visit people on the way, or they would stop in places that they didn't need to. So what we decided was that it's kind of short-term pain for a long-term gain. And having the isolation hotels where we actually know where they are, we actually can keep monitors there, watching the rooms, ensuring people stay in the room, their supplies are there. We get a chance to test them after 7 days. So we know that, okay, we've got this sorted out, and then they can go home. Now, would I like to think that, in a few weeks down the road, maybe there's cases and we can look at this differently? Because every week we're looking, maybe. But right now, we're trying to monitor all travel, and particularly leisure travel. That was unnecessary. Because, we asked everyone not to travel. And so if people have decided that, well, I'm going to go south anyway, that's a problem. And we'd like you to stay south for just a little longer.
The criteria for the hotels being chosen themselves, what are you as a government doing in choosing them? Are there specific criteria?
Well, ideally, we would like to go and out for like an RFP situation where hotels could kind of bid on the process. But when we put this in place as of Friday, because of what we're seeing around us, we needed to react very quickly. So, I won't say that I don't have a list of criteria here, or one hotel can manage or not, but certainly the ability for hotels to meet all of the public health rules and requirements, so separate, entrance, exits, and this sort of thing, would be part of that. And I actually, that list should be available on the website, but I can send you that, Teresa.
Thank you.
Global TV.
Thanks, Bruce. I'm looking for clarity on section 36F1 of the mandatory order. It says isolation facility guests are responsible for the cost of their stay, except if they're a New Brunswick resident outside the province for work, business, or in connection to a serious illness in the family. So if someone who has been approved for travel and they're currently in Quebec, moving an ill family member home to New Brunswick to care for him, would the individuals indeed have to stay at a designated hotel? And would they be paying the costs, or would the province?
So I can answer that. And I guess in the case of someone there on a bereavement leave or with a health concern, there are special circumstances that are looked at from public safety and how we manage that. And so in that case, whether that would apply for an exemption or not, but recognizing there was a need to travel. And so getting to the cost, what we're differentiating from here are people that were leisure time travelers versus those that were work-related travels or essential travelers. So we need to have the isolation protocol to be the same, but we feel that if you had an option not to travel, but you did it anyway, then the cost is yours. But if you actually are working and traveling because of your work, if you're traveling because you're providing essential service, whether you're working in our province or you're driving, and bringing goods into our province, or you had to go because there's a case of a bereavement and a personal situation, we'll look at those. But we are separating primarily, it's leisure, optional travel versus essential travel.
Thank you. Clara Pasica, Times and Transcript.
Good afternoon. My question is for Dr. Russell. So early in the rollout, the thought was always that if you had, your first dose was Moderna, the second dose that you'd get was Moderna. But since we began rolling out, we've seen changes in expected shipments, changes in age ranges of who should get certain vaccines, and also new scientific ideas where some research is saying there could be merit to mixing it up and giving people a bit of a cocktail of sorts, is being sort of said colloquially. So what is New Brunswick's position on that, and what is being considered? Could perhaps someone receive their first dose of Pfizer and their second dose of Moderna, and what's going into that thought process?
We receive all of our guidance from NACI, the National Advisory Committee on Immunization. So their advice up until this point really has been to utilize the same vaccine that was given for the first dose. Certainly, any worries or concerns about mixing the types of vaccine, I think with an mRNA type, whether it's Pfizer or Moderna, if there was a difference in availability that impacted our decisions around being able to provide the same vaccine for the second dose, then certainly I don't think anybody has a problem with being able to switch those out if need be. I don't see that happening out of necessity. I think we'll have the right amount of doses to be able to do that. The only thing that really came into question in the last several weeks is around AstraZeneca and the changes around who would be eligible for it and not, and if there was an age limitation, then somebody who had already received a first dose of AstraZeneca, would they be able to get an mRNA vaccine as the second dose? And that conversation is not finished, and so we are still waiting for data to come from the UK because they are the ones that are doing the research on mixing different types of vaccines in terms of first doses and second doses.
Thank you. Tim Roselle, Global News.
Thank you, Bruce. My question is for the Premier. A little off topic, but another QP local has declared a deadlock in contract negotiations with the province. They say that the province is refusing to bargain fairly. Just wondering, Mr. Premier, if you can comment on that and if you can characterize the province's relationship with public sector unions.
Well, I can't comment specifically on that, on what you just made a statement on. I'm not aware of that particular situation right now. Look, I would like to think that we'll have a good path forward here with all public sector workers. We have throughout this process tried to balance, our province. So we kept people working, we kept our economy rolling, and we know that it meant more to others than others in relation to being what they had to do during the pandemic. But we also kept everyone employed through the pandemic and through the public service. And that was all part of a decision to protect families and protect individuals. So the idea is what's our relationship going forward? I'm hopeful that as with I am appreciative of everyone here and what the work they've done. They'll too will be appreciative that we come out the other side of this with a province, with an economy that is still intact, with a system that doesn't needed to raise our taxes, and an expectation that we do right by workers and we work together for the outcome of the province that's necessary. So I'm not familiar with this particular situation. I'll probably will ask some questions about it after this, but I'm looking forward to a relationship where we all rebuild New Brunswick together.
Thank you, Mr. Roselle. Thank you, Premier Paige Woodard, Miramichi Leader.
Hi, my question is for the Premier. I spoke with the Rod Miramichi today, and they said they backed out of the hotel isolation plan, as did the Woodstock Hotel. So can you speak to what happened between the province and these hotels, and if the province has any contingency plans in those cities?
Well, I can't speak to what the particular reason was that they actually backed away. We do have a criteria there, as I mentioned earlier, that is implemented by our public safety folks. And we just need to make sure that these facilities can meet the public health requirements when people are staying there. So I can't really speak to that. The criteria it should be pretty straightforward. And if a hotel chooses to participate or not, then that's their choice. But I'm confident we'll be able to find enough facilities in the regions necessary to meet our requirements. And we'll monitor that, as I said earlier, weekly. We'll look at the situation, look at each region, look at each zone, look at how the programs are working, and we'll adjust as required because we've done it now for 16 months.
Merci beaucoup tout le monde. Thank you very much, everybody. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.